Hello, dent tubers. Today we will learn about gingiva. Periodontium is a dynamic structure composed of the tissues supporting and investing the teeth. It consists of soft tissue component, which includes gingiva and periodontal ligament, and the hard tissue component, which includes cementum and the alveolar bone. Before going through gingiva, let's learn about oral mucosa. Oral mucosa consists of three zones: the masticatory mucosa, which includes gingiva and the covering of the hard palate; the specialized mucosa, which includes the dorsum of the tongue; the lining mucosa, which includes the oral mucous membrane lining the remainder of the oral cavity. So, gingiva is the part of the oral mucosa that covers the alveolar processes of the jaws and surrounds the necks of the teeth. In an adult, normal gingiva covers the alveolar bone and tooth root to a level just coronal to the cemento-enamel junction. The gingiva is divided anatomically into marginal, attached, and interdental gingiva. The marginal gingiva is also known as free gingiva or unattached gingiva, which is the terminal edge or border of the gingiva that surrounds the teeth in collar-like fashion. In about 50% of cases, it is demarcated from the adjacent attached gingiva by a shallow linear depression called the free gingival groove. It is usually about 1 millimeter wide, and it forms the soft tissue wall of the gingival sulcus. The most apical point of the marginal gingival scallop is called the gingival zenith. Moving towards gingival sulcus. Gingival sulcus is the shallow crevice or space around the tooth, bounded by the surface of the tooth on one side and the epithelium lining the free margin of the gingiva on the other side. Under absolutely normal or ideal conditions, the depth of the gingival sulcus is 0 millimeters, which is also known as pristine gingiva. In histologic sections, sulcus depth has been reported as 1.8 millimeters, with variations from 0 to 6 millimeters. The so-called probing depth of a clinically normal gingival sulcus in humans is 2 to 3 millimeters. After enamel formation is complete, the enamel is covered with reduced enamel epithelium, which is attached to the tooth by a basal lamina and hemidesmosomes. When the tooth penetrates the oral mucosa, the reduced enamel epithelium unites with the oral epithelium and transforms into the junctional epithelium. As the tooth erupts, this united epithelium condenses along the crown, and the amaloblasts, which form the inner layer of the reduced enamel epithelium, gradually become squamous epithelial cells. Another anatomical division of gingiva is the attached gingiva. The attached gingiva is continuous with the marginal gingiva, resilient and tightly bound to the underlying periosteum of the alveolar bone. It is demarcated from relatively loose and movable alveolar mucosa by the mucogingival junction. The width of the attached gingiva is the distance between the mucogingival junction and the projection on the external surface of the bottom of the gingival sulcus or the periodontal pocket, whereas the width of the keratinized gingiva also includes the marginal gingiva. So the width of attached gingiva can be calculated by subtracting width of keratinized gingiva from sulcus depth. The width of the attached gingiva on the facial aspect differs in different areas of the mouth. It is generally greatest in the incisor region, 3.5 to 4.5 millimeters in maxillary incisors, 3.3 to 3.9 millimeters in mandibular incisors, and narrower in the posterior segments, 1.9 millimeters in the maxillary first premolars, and 1.8 millimeters in mandibular first premolars. Methods for measuring width of attached gingiva includes visual method and clinical method. In visual method, the mucogingival junction is demarcated from the color difference and surface texture of attached gingiva and alveolar mucosa. Alveolar mucosa is dark red and smooth with no stippling. The mucogingival junction is seen as a scalloped line. In clinical method, roll test is done by pushing the adjacent mucosa coronally with a dull instrument. The loose alveolar mucosa moves, whereas attached gingiva being attached to underlying periosteum does not move. Tension test is done by stretching the lip or cheek to demarcate the mucogingival line and to see for any movement of the gingival margin. Histochemical staining is done by using Schiller's iodine solution, which reveals glycogen stored in epithelium of lining mucosa, thus staining the alveolar mucosa, while the attached gingiva is unstained. Talking about interdental gingiva, the interdental gingiva occupies the gingival embrasure, which is the interproximal space beneath the area of tooth contact. The lateral borders and tips of the interdental papillae are formed by the marginal gingiva of the adjoining teeth, and the intervening portion consists of attached gingiva. The interdental gingiva can be pyramidal, mostly on anterior teeth, or it can have a coal shape, mostly on the posterior teeth. Interdental coal is a valley-like depression that connects facial and lingual papilla. It is non-keratinized and is vital in periodontal health and disease. The gingival epithelium consists of a continuous lining of stratified squamous epithelium. There are three different areas that can be defined from the morphologic and functional points of view: the oral or outer epithelium, the sulcular epithelium, and the junctional epithelium. The oral or outer epithelium covers the crest and outer surface of the marginal gingiva and the surface of the attached gingiva. It is prevalently perikeratinized. The sulcular epithelium lines the gingival sulcus. It is non-keratinized stratified squamous epithelium without rete pegs, and it extends from the coronal limit of the junctional epithelium to the crest of gingival margin. The junctional epithelium consists of a collar-like band of stratified squamous, non-keratinizing epithelium and is formed by the confluence of the oral epithelium and the reduced emel epithelium. The length of junctional epithelium ranges from 0.25 to 1.35 millimeters. The principal cell type of the gingival epithelium, as well as of other stratified squamous epithelia, is the keratinocyte. Other cells found in the epithelium are the clear cells or non-keratinocytes, the Merkel cells, and the melanocytes. Langerhans cells have an important role in the immune reaction as antigen-presenting cells for lymphocytes. They contain G-specific granules, Burbeck granules. Merkel cells are located in the deeper layers of the epithelium. They harbor nerve endings and have been identified as tactile perceptors. Melanocytes are dendritic cells located in the basal and spinous layers of the gingival epithelium. They synthesize melanin in organelles called melanosomes. Now let's understand about stratified squamous epithelium. Stratified means arranged in layers, and squamous means flat type of cells. It consists of 4 layers: stratum basale, basal layer; stratum spinosum, prickle cell layer; stratum granulosum, granular cell layer; stratum corneum, cornified layer. The uppermost layer, stratum spinosum, contains numerous dense granules called keratinosomes or Odlin bodies, which are modified lysosomes. So in this histologic picture, we can see from the base towards the surface, the cells are progressively flattening and the cytoplasmic contents and the nuclei are disappearing gradually. This is the typical feature of keratinization. So, the keratinosomes contain acid phosphatase that plays a major role in dissolving the cytoplasmic contents. The basal cells begin synthesizing lower molecular weight keratins, which, while migrating towards surface, increase in molecular weight due to further deposition of keratin and dissolution of other contents via acid phosphatase. So we can correlate. Lower molecular weight keratins, K19, are expressed by basal cells, whereas higher molecular weight keratins, K1, are expressed towards the surface, and the glycogen content in normal gingiva is inversely related to the degree of keratinization and inflammation. Other proteins unrelated to keratins are synthesized during the maturation process, which includes keratolinin, involucrin, and filaggrin. Keratinization can be orthokeratinization, which is a complete keratinization with no nuclei in stratum corneum and a well-defined stratum granulosum. It can be perikeratinized, which is considered to be an intermediate stage of keratinization, and it is the most common type of keratinization in the oral cavity. In perikeratinized epithelia, the stratum corneum retains pycnotic nuclei, and the keratohyaline granules are dispersed rather than giving rise to stratum granulosum, whereas the non-keratinized epithelium has neither granulosum nor corneum strata, whereas superficial cells have viable nuclei. Keratinization of the oral mucosa varies in different areas in the following order. Palate is most keratinized, then gingiva, then ventral aspect of tongue and cheek is least keratinized. Generally, orthokeratinized areas express K1, K2, K10, K12. Perikeratinized areas express K19. K6, K16 are characteristics of highly proliferative epithelia except junctional epithelium. Junctional epithelium expresses K19, K5, and K14. Moving forward with gingival connective tissue, which is also known as lamina propria. It consists of collagen fibers, fibroblasts, vessels, nerves, and matrix. Connective tissue of gingiva consists of 2 layers. A papillary layer which is subjacent to the epithelium and consists of papillary projections between the epithelial rete pegs, and a reticular layer that is contiguous with the periosteum of the alveolar bone. Type 1 collagen forms the bulk of the lamina propria, whereas type 4 collagen is continuous with the fibers of the basement membrane. The preponderant cellular element in the gingival connective tissue is the fibroblast, which synthesize collagen and elastic fibers. Physiologic dimension of junctional epithelium and connective tissue attachment above the crest of alveolar bone is termed as biological width in 1961 by Gargiulo et al. The term biologic width is replaced by supracrestal tissue attachment in 2018 by Jepson et al. The average value for biological width is 2.04 millimeters. The connective tissue of the marginal gingiva is densely collagenous and it contains a prominent system of collagen fiber bundles. These fibers consist of type 1 collagen. These fibers have the following functions: braces the marginal gingiva firmly against the tooth, provides the rigidity necessary to withstand the forces of mastication without being deflected away from the tooth surface, unites the free marginal gingiva with the cementum of the root and the adjacent attached gingiva. The gingival fibers are further divided into principal fibers and secondary group of fibers. Principal fibers include dentogingival, alveolo-gingival, dentoperiosteal, circular, and transeptal fibers, whereas secondary group of fibers include periosteogingival, interpapillary, intercircular, intergingival, transgingival, and semicircular fibers. The junctional epithelium and the gingival fibers are considered together as a functional unit referred to as the dentogingival unit. Now, let's talk about blood supply of gingiva. The sources of blood supply to the gingiva includes supraperiosteal arterioles, vessels of the periodontal ligament, arterioles which emerge from the crest of interdental septa. Clinically, gingiva has unique features. The color of normal healthy gingiva is coral pink or salmon pink. Color of the gingiva is due to vascular supply, the thickness and degree of keratinization of the epithelium, and the presence of pigment-containing cells. The size of the gingiva corresponds with the sum total of the bulk of cellular and intercellular elements and their vascular supply. Alteration in size is a common feature of gingival disease. The marginal gingiva envelops the teeth in collar-like fashion and follows a scalloped outline on the facial and lingual surfaces. The shape of interdental gingiva is pyramidal in anterior teeth, whereas the papilla is more flattened in a buccolingual direction in the molar region. The gingiva is firm and resilient, with the exception of the movable free margin. The gingiva presents a textured surface similar to that of an orange peel and is referred to as stippled. The attached gingiva in the central portion of the interdental papilla is usually stippled. Stippling is produced microscopically by alternate rounded protuberances and depressions in the gingival surface. The position of the gingiva is at the level at which the gingival margin is attached to the tooth. That's all for gingiva. In detailed discussion about junctional epithelium and other structures will be included in upcoming videos.